Hi, my name is Karl Tiffen. I'm 17 years of age, and on the 8th of September 2013, exactly 2 years and nearly 2 years to the day, I was diagnosed with a DVT. There's my leg when I first went to A&E on the 10th of September because I was diagnosed I was playing football on the 8th of September, and I decided to take a shot and I pulled the muscles in my leg, and so went to the GP and the next day, and they said that I'd done nothing but sprained the muscle in my leg, and then the pain got worse, and so my mum decided to take me to A&E because I couldn't bear the pain anymore. And then that's when they'd done an ultrasound and said basically I've just torn the muscle and I was to wear a tubey grip dressing, but it was impossible to wear because my thigh was so swollen. It was almost double the size of my other leg, and it was red hot and it was extremely painful to touch, and it just got worse. And then eventually they suggested another ultrasound was done, and that was on the 1st of November 2013. And that was a life changer because the radiologist strung words into my head, and they said to me that I was lucky to be here when I did, because it extended from my top of the knee close to my abdominal wall, and that moment forward I was restricted to bed rest, and I wasn't allowed to move as I was at great risk of having an embolism. Blood tests were needed and treatment needed to begin straight away to stop the clot from extending, and I was put on 4 days of Clexane and 4 days of warfarin before I was discharged from hospital. And they tried to explain as much as they could, and thankfully I had all my family with me. I had my mum there every day. I had my dad who worked around the corner. He came and visited me, and my stepdad always used to come as well, and so that was always reassuring. I had them on my side. But as I'm needle phobic, every day the blood tests, I was so scared. Every day I was freaking out, and I just refused to have them. And it got to the point where they would have, like my mum and her friend one day would help me to have the blood tests in my arm, and then for 8 days it was constant, and also the stomach injections were constant, and they wouldn't even be at a certain time. It would be different times a day. And then I was referred to Great Ormond Street Hospital after I was discharged because Watford didn't know what to do really. But then once a date had been arranged for me to go to Great Ormond Street, they realised I was too old to go as I was just turned 16. And so then they sent me to UCLH, and then I met a new haematologist, and she sent out for scans and things like this. And then, as on this scan shows here, it basically shows the blood flow in my legs, and where the black bits are, it basically says there's no blood flow going through whatsoever. And the blue is the blood flow, and the red is where there's slight blood going through. And only my right leg was scanned because that's where they originally thought it had gone to. And then I met with UCLH, a surgeon, in July of 2014, and they explained the types of treatment that were available, like the stenting, the venous reconstruction, and then he arranged for other scans to go. And then he noted that I had obvious dilated superficial veins, which suggested deep vein thrombosis and venous obstruction was needed. And my haematologist already stated that I had IVC thrombosis with left lilac vein. I can't say that word anymore. I think it's like propagation or something, with collateral circulation going through my abdominal wall. And then that's basically my veins on my stomach, which I still have to this day, and I'm pretty sure I'm going to have them because it's just always there. And my follow-up with the surgeons again after 6 months was positive. It was clear to them my CT scan had failed, and the dye didn't travel into my legs as well as they hoped, and that surgery was the way forward, but I would need an endovascular ultrasound to check out the potential landing zones for the stenting procedure combined with the vascular reconstruction. However, my condition is chronic and extremely difficult, so I have to wait at least 3 to 5 years for this, and so I am to accept the possibility that I may lose the use of my legs before I have my operation. As the consultant has said before previously, I'll have to use my brain instead of my legs from now on, because I used to be very clean at playing football, but I can't do that anymore. And then now it has become apparent that the clot has now extended into my left leg. As you can see there, both legs are now swollen, and the veins are on my legs as well, and they go right down. And I'm on currently 9 milligrams of warfarin a day, and there is still no reason why I have this blood clot. So it's just been put down to bad luck. I see my haematologist every 6 months, likewise with the vascular consultants. I have blood tests every 4 to 6 weeks to have my INR level checked, and I continue to enjoy life as much as I can. I was able to complete my college course and now qualified at level 1 and level 2 of mechanics, but finding employment hard because of my condition is difficult. I do have days where I struggle with leg swelling on these days, but on these days I do know how to chill, as this picture next shows when I was in Plymouth. And then I'm hopefully going to be entering a Santa Fun Run 5K for Thrombosis UK this year. And thank you for listening.